I'm very happy to introduce a special guest to you. This is Nina van der Linden. She's a trained nutritionist and a registered dietitian, and she's currently working as a clinical dietitian in our National Hospital for Pediatric Oncology. Nina and I met each other in a working group for childhood cancer research, and I'm delighted that she's willing to tell us something about the nutritional care of cancer patients. Hi Nina, welcome.
Thank you.
It's very good to have you here.
Thanks.
So I would love to learn more about your work. Would you be able to tell us something about the work that you're currently doing?
Yeah, sure. As you said earlier, I'm working at the Princess Maxima Center for Pediatric Oncology, and I'm working there as a clinical dietitian, doing both inpatient and outpatient work. So the kids that come in are admitted to the hospital, but also the kids that are just coming for a visit with a doctor or a physiotherapist. I see them as well. And there I work with the kids, like I said, but also with a kid always comes a parent. So you always have the duo of the families as well, which makes it an interesting group to work with.
Okay, so what sort of problems do these children have when they refer to you?
Can be actually anything to do with nutrition. Some of the big ones that we see a lot are weight loss, malnutrition because they can't eat anymore or don't want to eat because of decreased appetites, but we also see weight gain due to medication use. A lot of the times it also an influence is mucositis, and that can be anything from the mouth all the way to the anus that is disturbing their digestive problems. We also see a lot of smell and taste changes which influence their appetite and their eating habits. Behavioral changes as well, that they don't want to eat or want to eat a whole bunch because of medication or just because they're not feeling well, because of pain. And then also the whole aspect of the food hygiene plays into there as well, because they're all immunocompromised patients.
Okay, so you said that like the medication and also pain may have an impact on nutritional behavior, nutritional status. So most of the common problems that these patients have, are these caused by the cancer itself or rather by the cancer treatment?
It can be both. If they're caused by the tumor itself or the cancer itself, that could be if there's a tumor in the stomach that's pushing on the stomach that makes them not feel well and they're not able to eat, or if they have a tumor in their throat where they're not able to swallow. So that would be kind of be the causes of the tumor itself. But most of the time it's because of the treatment or the complications that come along with treatment. So because of the chemotherapy, they're really nauseous or they're vomiting, they're not feeling well, or because some of the medications they have to take next to the treatment that cause constipation or diarrhea, that could also be causing some problems. And then there's also the kids that take prednisone, and that really influences their behavior and their eating habits. So that also plays a role.
Is there when actually should a patient be referred to a dietitian? Is there a specific guideline or recommendation for that?
There's not really anything for us in our center right now on paper. We're working on protocols so that the doctors know exactly when they should refer to us. But right now it's actually, we're referred when a doctor signals that there may be a compromised nutritional status of the child. So if they anticipate that, which is what we usually want, because then we can kind of nip the problem in the butt before it gets too big, or if there's already weight loss or weight gain, then we're usually called to come into referral.
So could you also tell us something about the sort of advice that you can give to these patients? So what can you recommend to these patients?
Yeah, for sure. So usually we start with, we always do individual advice that's based on the symptoms of the child or what they're experiencing at that time. Because the children go through a lot of changes in chemo or a lot of different regimes, our advice also changes really quickly from week to week, because one week they're feeling really good and the next week they're admitted to the hospital with fever, diarrhea, whatever, you could name it. But usually we start off with trying to, I guess not really fix the problem, but we advise them dietary changes with normal foods that they can do at home. So that could be things like if the child has a decreased appetite and they've lost a lot of weight, that we would advise consuming more protein, but also more calories, some more energy. And that could be simple things like changing all your products or making product choices to full fat products, adding extra layer of butter to your bread, royally using sauces or condiments like mayonnaise, something that has a lot of calories. So simple tips like that to increase the amount of calories in the diet of the child, so that every calorie counts to their weight, of course. If that doesn't work, we usually step over to oral nutritional supplements, so beverages that the children can drink to boost their weight again. Sometimes drinking is a little bit easier than physically eating for the kids, so that can sometimes be a solution. But sometimes that's not the solution. They can't eat, they can't drink, everything is really difficult at that time. And then we step over to enteral feeding or tube feeding. And unfortunately, most of the kids that go through a chemotherapy or a cancer treatment journey will have tube feeding at some point in time. So we usually resort to tube feeding. With children, it's a lot easier to also, the young ones of course, to start tube feeding because they already have a nasogastric tube for medication because they can't swallow all their medication. So that step to start tube feeding is a little bit easier than for adults. And then in the cases of really severe mucositis, you can always turn to parenteral nutrition. That's again a step, a more intense step, I guess. And then kind of stepping away from that when the children are done their treatment or their chemotherapy, or if they can eat again, then we usually tailor our advice to trying to get them back into a normal eating pattern or a healthy eating lifestyle.
So actually during the treatment, the major concern is weight loss?
That's probably that's the biggest one that we come across. Yeah.
So is there also a specific moment during or after treatment that you're mostly concerned about weight gain? Is that also something that you see in clinic?
Yeah, but that's usually linked to medication use. So the prednisone. Sometimes how the kids take their medications or their whole regime, they always have a period where there's weight gain and then a lot of periods with weight loss. So the weight loss is usually larger, or the decreased appetite than the increased appetite. But with a lot of kids, there's a period of both.
Okay. And I was also wondering, how is the referring organized? Can a patient or a parent decide by themselves that I want to seek for nutritional support, or is there always a medical team or a medical specialist involved in that?
Yeah, right now there's always it always comes from the doctor. So either the doctor that's in charge of the patient or one of the sub-doctors under that one. But it's pretty easy that if a parent says, I have some questions, I would like to speak to a dietitian, they would refer to us automatically. Those lines are pretty open and the communication is pretty open. But unfortunately, right now, the parents can't seek advice just by themselves.
Yeah. Okay, and so you are working specifically with young children, young patients. Do you think that there are any differences in nutritional complications and nutritional care that you see in these children as compared to adults with cancer?
Yeah, definitely. I think the biggest one is because you have growth as a factor in children, you don't have that as an additional factor with adults. That kind of the base of all the nutritional care is trying to keep their growth on track. Because of the therapy they're going through, they could have a stunted like growth in height, or they could lose weight, which also impacts their growth. So that's kind of an added aspect that you don't have with adults. And also a big difference is that kids primarily react to what they're feeling and their symptoms. And if you tell an adult you need to eat even because you're not feeling well, but you need to eat because you need to gain weight to become stronger and to withstand your treatment, a kid doesn't understand that. They only understand, I have pain in my stomach, so I'm not going to eat. You can't tell them to eat. So in that way, the parents play a huge role in motivating their children, but the parents also have a huge role in kind of steering that we can't control. So that's one of also the really big differences between adults and kids.
So I guess that you as a dietitian also play a major role in that motivating process.
Yeah.
So I was wondering, what do you love most about your job?
I think I love most the contact that we have with families because the kids are in the hospital so often. Every couple weeks they come for a new chemotherapy. Sometimes they stay 5 days, they go home for 2 weeks, they come back for 5 days. You see the same families a lot. So you build a relationship with the families and the kids, and you have your patient, the kid, but then of course also brothers and sisters that are involved, grandparents that sometimes come along. So you really get to know the families, and I really like that aspect of it a lot.
Well, I think that is a beautiful answer.
Thank you.
I would like to thank you very much for your inspiring information.
Of course.
And your come to this place. And I would like to thank you And I hope that we can continue in research together, and I hope that you will be able to help many more cancer patients in the future.
Thank you.
Thank you.